everyone, to the audience who have joined us for the webinar this evening that is sponsored by the CSJ Center for Reconciliation and Justice. And we want to extend great thanks to the CSJ Center for the support of this webinar. My name is Wiebers, and I would like to introduce our speakers this evening. First of all, I would like to introduce Professor Anna Muraco, the chair of the Sociology Department at Loyola Marymount University. Professor Anna Muraco has been a member of the LMU Sociology Department since 2006 and is currently the department chair. She teaches sociology of marriage and families, qualitative research methods, sociology seminar, and sociology of aging. Her research focuses on the intersections of gay and straight life, aging and the life course, kinship, friendship, and families, and caregiving. She was a co-investigator on the Aging and with Pride studies under the University of Washington School of Social Work, and has been the author or co-author of 23 peer-reviewed studies. And is the author of the book Odd Couples, Friendship in the Intersection of Gender and Sexual Orientation. She's currently working on her next book, Aging Under the Rainbow, about the experiences of LGBT adults aged 50 and older. Next, I would like to introduce Tripp Mills, the Associate Director of Housing and Training, Senior Services at the Los Angeles LGBT Center. Tripp has over 25 years of experience working within the LGBT community. In his current role as Associate Director of Housing and Training, he's overseeing the lease up of the Ariadne Getty Foundation Senior Housing Project, slated to open in the winter of 2020. Tripp also develops and provides LGBT older adult cultural competency trainings to many organizers and long-term care facilities, organizations and long-term care facilities throughout Southern California. Other positions at the LGBT Center include Deputy Director of Senior Services and Associate Director of Health Education in 2006. Prior to joining the center in 2014, Tripp worked as the Director of Resident Services for two nonprofit affordable housing developers in the city of Los Angeles. Tripp has served as a guest speaker and speaker throughout the country on LGBT aging, creating affordable housing for the LGBT community, and the history of Los Angeles LGBT Center. He has also developed LGBT cultural competency trainings for health and human services agencies for Ventura and Orange counties. He received an appointment to the Los Angeles Purposeful Aging Task Force in 2016 and the Department of Aging's Elder Abuse Task Force in 2017. And he received his graduate degree at the Trinity Rep Conservatory. Next, I would like to introduce Bill Sive, President of Gay Elder Circle. Bill has been engaged in the LGBTQ+ community for many years as a youth, adult, and now elder. He has contributed his personal time over the years to the Orange County, Long Beach, Los Angeles, and South Bay LGBTQ+ centers. He was one of the original founding members of the then called Gay Student Union at Cypress College and California State University, Long Beach. He currently serves as the president of the Gay Elder Circle, the vice president of the Long Beach Gray Panthers, and is the social media director for PFLAG Long Beach. He's an active member of the Senior Advisory Committee at the LGBTQ Center of Long Beach. In addition to these roles, he was a contributing community member for the Master Plan on Aging for the state of California, and currently with the LA County Department of Mental Health, LGBTQIA2S+, USCC, the Underserved Cultural Communities Subcommittee. Bill has been a mentor for the Diversity and Inclusion Committee at Comerica Bank, Tex Ed CSULB, a mentor for Business Resource Group Drive, Equity at Hyundai Motors America, and PRISM at American Honda Motors. He believes in a strong LGBTQ+ community and attends many forums advocating for LGBT+ inclusive policies, this including the work for LGBTQ+ inclusion in the 2020 census and the first ever LGBTQ+ Senior National Day of Advocacy and an age-friendly Pride Guide with Sage USA. He believes in giving back to our community by actively participating in various charitable events. He's a member of the U.S. Masters Swimming, as well as a certified U.S. Masters swim coach, and he coaches competitive swimming, open water swimming, and triathlon. And finally, from the East Coast, Aaron Tax, the director of advocacy for SAGE in Washington, D.C. He advocates for LGBT inclusive federal aging policies that account for the unique needs of LGBT older adults. Until June of 2011, Aaron served as the legal director at Service Members Legal Defense Network, the leading organization challenging Don't Ask, Don't Tell in Congress and in the courts. He started as a staff attorney in 2016, and for nearly 5 years at SLDN, took part in the multifaceted approach to advancing the civil rights of LGBT service members through law, policy, outreach, and education. As the legal director, Aaron was responsible for running the legal services program at SLDN, the only organization providing free legal services to service members impacted by Don't Ask, Don't Tell, and related forms of discrimination, including those who are HIV positive and or transgender. Prior to joining SLDN, Aaron spent 3 years working for the Department of the Army in the Office of EEO and Civil Rights, the first 2 years as a Presidential Management Fellow, and as a Presidential Management Fellow, he worked for the Office of the Staff of Judge Advocate, the V Corps Heidelberg, Germany, and served as a Special Assistant United States Attorney in the U.S. Attorney's Office for the District of Columbia, where he tried more than 24 cases. A graduate of Cornell University with honors and distinctions, and the George Washington University Law School with honors, he currently resides in D.C. Thank you all for joining us and for participating in this panel that was this idea a year ago. And I'd like to also give a couple more things. Shout out to Sister Judith Royer and Sister Marianne Huper for their support in this undertaking. And one last thing, in the early advertising, we had a panelist, a speaker from the Black AIDS Institute here in Los Angeles, but due to staffing changes and within the organization, Bill so lovingly and wonderfully agreed to step up at the last minute to replace her. So thank you, Bill, so much for that last minute Hail Mary. And with that, welcome all of you. And I will now turn this over to Professor Muraco for this wonderful discussion this evening.
Here we are. Thank you, Leon, for that lovely introduction. And what I'll be doing is asking a question that each of our panelists will be able to address. And, you know, you can, whoever wants to go first is welcome to do so, and maybe we can rotate a little bit. And I will be happy to say the question again in between our speakers so that we all remember what we're talking about. Sorry, I live near the airport and something just took off. Literally something just took off. Okay, so the first question is, please discuss what you see as one of the most significant challenges that is currently affecting the LGBTQ plus older adult population.
I'll go first.
All right.
Thank you, Tripp. You know, I think the biggest challenge is, especially for providers, whether those providers are mental health providers or social workers, is that throughout their education, especially after the American Psychiatric Association unlisted homosexuality as a mental disorder, is truly understanding the historical trauma that LGBTQ older adults have brought with them. For instance, when Eisenhower wrote the executive order to kick LGBTQ people out of federal jobs. When I see that, and when I do workshops, I explain to people, that is when you started to see LGBTQ people having a public persona and a private persona. They started splitting their personal lives into two different places. And when you see these types of policies put in place, you're seeing the structural biases being built in. So LGBTQ population, especially older adults, you know, now they would be in their mid to late 70s and above. It's people that are younger, it's understanding how that historical trauma still plays into their lives today. And it's part of my mission on some of the workshops I do is to relate those statistics to that historical trauma. And I've encountered many students and faculty members that say, like, I didn't know that. I didn't know how those statistics tied into historical events. And so tying that together has, for me and the audiences in my workshops, have proven to be very enlightening and very opening up in relating to older adults and understanding how this all plays into effect in their old lives.
Great, thank you.
Aaron, do you want me to? I can go next.
Sure,
Okay.
go nuts, and then I'll.
Why not?
chime in.
All right, I'll go next. Sure. And first of all, I want to say thanks to Anna and Leon for inviting me to the panel today. And I do want to say, Bill, I've known you for a few years. I had no idea that you were a swimmer. That's new information. I think that's fabulous. And to the question, it's a really big question. You know, I've been thinking about this question for a few days because my automatic response always is affordable housing. We need more affordable housing. We need more affordable LGBT affirming housing. That's just sort of the lens that I you know, see everything through right now. And so, but really, I sort of fielded this question with, you know, my peers at work and had a couple of discussions. And I think COVID-19, if I were to think of anything that was really prescient and, you know, current, it's COVID-19 and how it's really highlighted the inequalities in healthcare and so forth. And specifically, when I think of the older adult LGBT community, you know, I know we talk a lot about isolation. We talk a lot about increased rates of poverty and disability in our community. And I think what we've learned, especially in the last 18 months, how these things have been exacerbated because of the pandemic and what those needs really are. So I would say at this point, COVID-19 and affordable housing are almost at an equal space in time. And I hope that in the next year, you know, of course, the pandemic, hopefully the pandemic will begin to wind down and so forth. But what we learned through the pandemic was that the needs of our community were even greater, specific to things like food insecurity. That was a huge issue that presented itself early on in the pandemic. And, you know, we could even talk a bit more about isolation in the community and how we have greater rates of isolation in the LGBT older adult community and how the pandemic exacerbated that. And some of the things that the center did to respond to that included, you know, a Hello Club where we reached out to our older adults through a volunteer base where we were giving them sort of social connection, and we created a pride pantry where we were providing them with food. And of course, older adults were more at risk for COVID-19. So that was also another issue that sort of exacerbated itself in the pandemic. So I would say this, for me right now, because we're in the midst of providing services during the pandemic and how that has changed how we provide service, because the need does not go away. It doesn't, you know, just because there's a pandemic and everything stops doesn't mean the needs don't stop as well. I also just wanted to sort of highlight one thing that was when Leon was, doing my bio, and the Ariadne Getty Foundation Senior Housing was supposed to be leased up in 2020. It actually was put on a huge pause because of the pandemic. So we're still in the lease up process. But I would say COVID-19 has really been, from my point of view, the biggest challenge we faced, and it's the one facing today.
So the issue I'm thinking of is sort of from the policy perspective, but I would say, invisibility of LGBT older people and misinformation about the challenges they face. And the reason I bring that up is I think there are the misconceptions that LGBT folks are better off than the population at large. There's just, the stereotypes that, everyone must be like Tim Gunn or, two, rich gay white guys in their nice, BMW convertible, and that's, in West Hollywood, and that's it. That's the LGBT community. So I think there's those misconceptions, and then on top of that, in many ways, maybe because, it's not like there's like it's not like if you come from like an Irish family, you have Irish grandparents and Irish parents, then you have like the Irish kids or something, and then you have those traditions that are passed down, about your family or your traditions or whatnot. Like, generally speaking, we don't have that in the LGBT community. So it's easy to think of, LGBT folks as just the same people in your age cohort, and that there's not, you can feel very much distant from the generation that came before you. So I think that invisibility is an issue. And then, there's the issue we see about LGBT folks going or feeling the need to go back into the closet as they get older, as they enter a more vulnerable point in their life. So there's that type of invisibility too. So I think it's this kind of thread that runs through a lot of the issues we talk about.
Thank you. You'd think by now I'd be used to the whole Zoom thing and unmuting and muting. Thank you all for your responses. So the next question is more related to policies and politics. It's what national policies and political setbacks have affected the lives of LGBTQ plus older adults?
Shall I jump in? I mean, this is, I would really, in many respects, defer to Aaron on this question specifically. It's not my specialty per se, but from a policy point of view, and again, I looked sort of through the housing lens. So I, looking directly at HUD and HUD agencies and so forth, and how housing is allocated and created, that we need a better policy in place to provide housing, affordable housing, targeting older LGBT adults. I also just want to say too, the Trump administration seemed to really sort of decimate a lot of legal protections, or attempted to decimate a number of legal protections in the LGBTQ community, specifically with our trans members. And I know some of those things have been more or less resurrected by the Biden administration. But my specific point of view is definitely a housing point of view. And I would even say that before we look at sort of federal protections, we have to look at state protections and local protections. And I think, what did they say? Everything global starts at the local level. So it's really like looking through our local policy and our statewide policies, how we create LGBT affirming housing, creating protections for our excuse me.
I mean, I guess concrete one I could think of from the Trump administration, among many, many, many others that specifically targeted LGBT older folks, was the survey. It's this little wonky little thing, but it's the National Survey of Older Americans Act participants, which measures the efficacy of the Older Americans Act, which funds programs like Meals on Wheels and other programs that enable people to age in place. So it's the survey that measures, whether that's meeting the needs of the most vulnerable people in the country. And under the Obama administration, SAGE and some other groups pushed them to include an LGBT demographic question set in that survey. And the one and only question out of the more than 100-page survey that the Trump administration decided not to keep and to proactively remove was the LGBT question set. And then we and many others pushed back. They re-included LGBT, but not T. Their excuse throughout all this is not that they're a bunch of homophobic bigots and transphobic bigots, which they were, but rather that the survey was too long. So I guess at least people feel enough shame nowadays to kind of cover up, where they're coming from. And we're working with the Biden administration. They're committed to re-including the trans question. Right now, we're waiting on a study from the National Academies, which will be out this December, and that's going to inform how ACL, the Administration for Community Living, goes about including SOGI questions in their data collection tools. So, that's, sort of a setback, but, we're on the right track there. And another one where, we kind of got a good outcome, but it just kind of gives you a feel for what we're dealing with in DC. Last year, we were working on the reauthorization of the Older Americans Act, which I just referenced. So again, that funds programs like Meals on Wheels and whatnot. And for the longest time, we've been trying to get some targeting language in the statute so that LGBT folks don't fall through the cracks. And we ran up against the majority in the Senate, not the current majority, but the last majority, who told us that there was no way we were allowed to say the words LGBT in the reauthorization, or they wouldn't let that language move forward. Which sounds kind of crazy in 2020, but that was their rule. We're not allowed to explicitly reference LGBT people. So we thought about, well, how about sexual and gender minority? And then they said, no, you can't do that either. So it's kind of hard to target LGBT people without saying LGBT, but we did find a way by indirectly referencing LGBT folks. And if you connect all the dots into legislation or now in the law, every single state Department of Aging, every state unit on aging in the country, and every AAA area agency on aging, which are kind of like county departments on aging, every single one of them now has to engage in outreach to LGBT older people, collect data on their needs, and collect data on whether they're meeting their needs. So that's federal law, which is great. And the Biden administration just came out with some guidance about how to implement that law. And in that guidance, they state that the Biden administration considers both LGBT older people and older people living with HIV to be target populations under the Older Americans Act. So that was really good, and a big difference from the last administration. So I think despite some of these setbacks, then Tripp mentioned there's a million others, whether it was the Trump administration fighting non-discrimination protections under Section 1557, the non-discrimination provision of the Affordable Care Act, or rolling back protections for trans people in shelters. There's just tons of them. But at least the current administration is trying to right the ship and move in the right direction.
So I want to ditto everything that Aaron said, because I'm on the round table with Aaron, so I would be in a bad position if I disagreed with Aaron. However, the great thing is that we live in California, and in 2019, 2020, the state of California, Governor Newsom signed the Master Plan on Aging, and that was put in place. Hundreds of, numerous meetings for pretty much a little over a year. And the great thing was when it was put into place, it really addressed minority communities, gender diverse communities. I participated in many of those discussions for the keynote speakers on data collection and equity and long-term services and support, and making sure that LGBTQ voices and needs were heard. So California has really put in this place. In this January of this calendar year, the Master Plan on Aging went into effect. So now people like me get to go to the state and to the county and say, like, where's my data collection? Show me my data. And we have moved leaps and bounds ahead of like other states in the country by doing this. But it gets unique, even though the Gay Elder Circle is based in West Hollywood, I live in Long Beach. So Long Beach has its own health department. So for the same issues on the Master Plan on Aging, I push that with the health department. How many LGBTQ people on the spectrum receive COVID vaccinations? Are there any kind of diverse outcomes based on hormone therapy, HIV and AIDS? So I'm actually asking my health department these types of questions. They're not used to having these types of questions put at them, but I'm not letting up. I tell people Larry Kramer was my role model. So we have advanced that. And, and for people that don't live in West Hollywood, I ask them, if you're secure in who you are and you're secure in your voice, go to your city council, go to your county representative, your county supervisor, and ask them to establish LGBTQ commissions. Have your voices heard in an organized manner, have your voices heard, equitably in the county or in your local community. And you cannot achieve equity or equality, however you want to approach it, without raising your voice to those who make policy and can agree upon it, whether it's at the county level or at the city level or even with the state. We are very fortunate that we have a fairly good LGBT caucus in Sacramento as well. So I push, I question, and I listen to Tripp very, very closely. I take a ton of notes during these monthly meetings, and I try to do what I can to implement them locally.
Great, thank you all. Okay, so our next question is going to get at housing specifically, so we can go get on to Tripp's favorite topic of conversation, which is great. That was so in LA, one of our key issues is lack of affordable housing. And this has been a national conversation as well, especially with respect to the end of the eviction moratorium that's happening. So can you please speak to your understanding of how this particular issue affects the lives of aging LGBTQ plus adults?
All right, shall I jump into this conversation? And how much time do we have? Yeah.
Master class.
I mean, we could probably do a whole panel on just this one topic, and it's such a huge issue. And specific to the eviction moratoriums too, that are literally pending in a few hours, right? So these are things that we've been anticipating now for several months, and it just keeps getting pushed back. And in the general landscape of affordable housing in LA, just talking about Los Angeles, where we have a deficit of like 250,000 affordable housing units. That's what we would need to do to build our way out of this. So that's just not going to happen. I don't want to get too off base here, but when you're looking at the housing crisis in LA County specifically, you're always the go-to, or the first thing you're looking at is the homeless population and the chronically homeless population, because it's so huge here, and how we go to sort of how the LGBT community is included in those homeless counts, because we're not really included in those homeless counts. We're not labeled. We don't have a space. We're fighting to get that we've been fighting to get that our community identified with LASA for the last, 2 or 3 years. There's a political action group, political action committee in LA, which is combining aging services and housing services together to really come up with some solutions to this. But anyway, so the challenges that exist really are for our community, of course, the lack of affordable housing, or currently where we're seeing the greatest need is, and this speaks to the eviction moratorium, is those at risk, because that in many respects is a greater pool or greater represents the LGBT community. That's certainly, there are vast numbers of, homeless individuals, older adults in LA County that I think are greatly undercounted, because and again, I'm just sort of getting anecdotal here, but when we look at homelessness in LA, we tend to think of the chronically homeless living on the streets, unsheltered, and so forth, but we're not also including people who may be couch surfing, who may be living in a pool house, maybe living in a garage, and so forth. And I certainly met a number of our older adults, that is the situation that they're in. So how do we prepare for this eviction moratorium? And it's a really great question. I'm open to what Aaron and Bill have to share, or you, Anna, what are some of the innovative solutions we can come up with regarding any sort of housing navigation program. I do know at the center we've been sort of prepping for this. We've been sort of getting ready to sort of deal with the onslaught of what potential evictions could look like, getting our community as educated as much as possible on tenants' rights, and how to prevent eviction, and how to work with landlords and so forth, and developing relationships with landlords who work with older adults. And it's really, I don't think, how can I say this? I think as prepared as we are, there's definitely going to be some fallout, and we're going to have to triage this a bit. And I really don't see the problem really, initially in a few hours that moratorium will end. but we'll really start seeing the results of that at the end of that moratorium sometime probably in November, December, and into January. We're really like right in the middle of winter where we're going to deal with this. You know, there's so, gosh, the need is so great. So I put it out there with our community members that anybody who's working in the aging or housing sector, that we be a voice for the LGBT community as well, because it's still an undermet and an underheard community in these, you know, especially in the housing world. Again, and I don't know if I'm answering the question because I, you know, was prepared to, you know, I was prepared to have this. Here's how it is, you know, you've got the homeless population at the top of the scale, then you've got multifamily, then you've got senior housing, and then somewhere at the bottom of the senior housing is the LGBT, you know, community, older adult community that needs housing just as much as anyone else. But our needs are greater because our rates of poverty are higher. And, you know, older adults live on fixed incomes. And, you know, it comes to sort of it sort of speaks to ageism and institutionalized ageism and institutionalized homophobia and transphobia and so forth, that this is a population where their housing needs are greatly undermet. I could keep dialoguing about this. I could keep talking about this. I'm curious to hear what Aaron and Bill have to say about this as well. So those are my initial thoughts. The other thing that I would say too when it comes to housing is, if I don't say anything about it tonight, this is what I want to say, is that we want to get as innovative as possible. I know everyone is looking for other solutions, especially in LA County, looking at accessory dwelling units and building multi-family units on single family, you know, zoned areas and creating more, you know, density in places where density doesn't exist. So I'm curious to hear what other people, you know, I open it up to our audience too, you know, to the creative minds out there. You know, if you have great innovation, bring it to the table.
Yeah, feel free to put those contributions in the chat for sure, and then we can follow up during our Q&A.
You know, I'll jump in here real quick. You know, again, hats off to Sage. Last week, Thursday and Friday, Sage hosted the 3rd annual Housing Summit, LGBTQ Housing Summit. So I attended both days, and there are discussions on co-housing, home share, or scattered throughout the 2 days. Very innovative programs coming out of Memphis, of all places, not a place known for that type of program, but very innovative programming coming out of there. But the biggest, I think, obstacles that we're facing is that, you know, our property owners are becoming more corporate, and the corporate is insensitive to the needs. They're all answering to Wall Street. And that's happening throughout the country. Corporate or Wall Street is the single biggest purchaser of single family homes right now in the country. So homes are being purchased at $50,000 or above asking price in many instances. And with LGBTQ historically not being compensated in their jobs throughout their history, so they're lower income, they may not be as well off. So especially lesbians. Lesbians are historically not well off financially as gay white men. And then if you want to layer on, you know, people of color on top of that, you can start seeing the intersectionality on housing. And it's not just housing, it's, you know, apartments, it's senior buildings. You know, you know, redlining has played a historical part of that. And unfortunately, for people like here in LA County, people that live in Pico Rivera, they would have to travel 2 hours to go see Tripp through a combination of bus and trains. And that's just not doable. Many places throughout LA County, we only basically pretty much have almost 4 LGBTQ centers. The main LA LGBTQ center, the one in Southeast LA that opened up about a year or so ago, the South Bay, and in Long Beach. But that doesn't serve the entire county. People have to travel quite a distance if they want specific LGBTQ services. And some of those LGBTQ centers, especially not LA, but are not prepared to handle this. Fortunately, in LA County, And in the state, we have Tenants Together, which has been gearing up for this eviction moratorium. Here in LA County, the LA Teachers Union are stepping up, and they're serving everybody. They're not just serving cisgendered people, heteronormative people. They're serving anybody that needs a need. Whatever your gender identity is, come and apply. We will help you. So there are organizations that are stepping up in addition to the LA LGBTQ Center. But it's understanding the historical financial challenges LGBT people have had throughout their lifetimes, getting on those HUD housing lists, which take years to work their way through. And then, just recently, a trans man that I know came out at 70 years old as a trans man. Horrified, absolutely horrified, scared to death to go into a senior building. So working very closely with that building. This trans man did not want the building people to know that they were transgender. We're actually scared that they might see the mail with the male name on the packages coming through. So we have to deal with these types of issues, even in senior buildings and HUD buildings. So again, older adults in their late 70s and 80s, they're still bringing this trauma. They're not, we're living in the age post-marriage equality. And in California, we have far more protections than, a lot of other states. But still, to have older adults just absolutely terrified to go into a skilled nursing facility. In fact, I'm working on that right now. Another 70-year-old lesbian, very, very healthy, but going into cognitive decline. So I'm working with my network to find a place that is LGBTQ welcoming and friendly and deals with cognitive impairment. This is not something that I do every day, but I'm working my network to get into it. So these are challenges because the people that provide these services, they don't, they're not putting rainbow flags, on their websites. They don't have, a certification that says we're LGBTQ cultural competent or LGBTQ humility. We didn't go through the training through the Department of Mental Health or through SAGE. We need these businesses, skilled nursing facilities, convalescent hospitals, HUD buildings to actually get that cultural competency training. And we need to be comfortable with that and know that, because not every city is going to have LGBTQ housing. We know this, but to know that their staff has gone through the training will put a little more people at ease and make it easier to network throughout the county to find housing solutions for people that are, at the lower economic scale, have, food insecurities, that type of stuff.
I mean, housing is certainly one of the biggest issues people bring up, and it's pretty much every conference I go to or any other event I go to related to LGBT aging, people talk about affordable housing. The interesting thing I heard about from a colleague recently, Sydney, who organized the housing symposium, is the definition of homelessness and how that could potentially impact LGBT older folks. So, if and also, relatedly, pathways to housing. So, for example, if to access affordable housing or to get on that track to affordable housing, you have to come out of the shelter system. If you're an LGBT older person or just LGBT person, generally speaking, and you're fearful of accessing a shelter because of actual discrimination, fear of discrimination, then maybe you don't end up in the shelter system and you end up couch surfing or figuring out another way to manage. And then you might miss out on the opportunities to access affordable housing. And you might also not be considered homeless because maybe you're couch surfing as opposed to being on the street or being in a shelter. So there's kind of a whole host of issues there with respect to how we define homelessness and how we get people on the road to affordable and welcoming housing. The other thing kind of related to this, it might be a little bit of a stretch, but that I think of is the continued discrimination people face, whether it's in what we think of like regular old housing, but maybe long-term care settings and other types of housing that older people need to access. And it reminds me of a call I got from a social worker just out of the blue in Colorado who had a trans client who was ready to be discharged from the hospital. And this was last year, so kind of in the middle, in the height of COVID, and needed to be in some sort of like rehab facility or long-term care facility. And this person was poor, she was on Medicaid, and pretty much every institution they approached said they would only put her in a single room because she was trans, but then she was also on Medicaid because she didn't have much money, and Medicaid would only pay for a double room. So she was kind of stuck in this limbo for many months because no one would take her, and yeah, she was just stuck. And luckily she had a good social worker who helped her out, but it took months and months and months of having to stay in a hospital during COVID, which isn't, you know, the ideal place to be. And, you know, you can imagine, you know, there's this person in this situation, you know, that was lucky enough to connect to someone who could help her. But how many other people are kind of in the same boat, and don't feel, you know, empowered to reach out for help? And I got to think there's lots of people in those situations who don't think, oh, I can just, you know, pick up the phone and call Lambda Legal and I'll get a free attorney and they'll sue the crap out of somebody. Like, people aren't probably, you know, normally thinking that way. And they just probably think, you know, this is how I've always been treated, and I'll just keep quiet and not stir up trouble. So I imagine there's a lot of that goes on. And, you know, unfortunately, we don't necessarily hear about it in a way where we can help folks.
I just want to add one thing. Okay, so I'm just going to add one thing too. The other thing is, like, you know, in regards to actually building affordable housing, which is very complex and use, you know, complex financial layers of financial, you know, programs and so forth. So it takes a long time to build this housing. So, and as someone, you know, as we're doing this right now, when you're building housing under all the fair housing laws and, you know, all the, you know, the rules that you more or less can, you know, house seniors in affordable, you know, there's no real space for or protections for LGBT. So it makes it even harder when you're marketing the housing, and you're marketing the housing under fair housing rules and so forth. You can't target specifically or show preference to the LGBT community. So you have to be somewhat, what's the word I'm thinking of? You have to be very, it has to be very targeted. It has to be inclusive. And then you get to a point where you're at the lease-up process where it isn't as affordable as you may think it is, you know? And that's the other thing, where a lot of people who are in this sort of middle range, where they're not necessarily very low income, they're sort of median low income or median income, may qualify for the housing or just barely qualify for the housing, but it still puts them at a financial disadvantage. So there's still a lot of barriers, and the barriers to affordable housing are huge for anyone. So it goes back to sort of that policy piece, which is where we create that space, or that that protected class for LGBT older adults. And maybe that starts at the state, at the local level or the state level, you know, because our fair housing laws in California are much broader than they are with the national umbrella. And, you know, we may have an opportunity in the next few years to sort of push that agenda. And I do want to say I was at the SAGE housing conference last week. You know, SAGE has really like moved the rope forward quite a bit in the last few years. And it's amazing to see how things have changed over the last 10 years in regards to creating more housing for LGBT older adults. But I want to say, in the grand scheme of things, if you look at sort of on a national level, the number of actual units that are provided for the LGBT older adult community, it's minuscule. It's really small. And it's really great to see that other communities throughout the country are, you know, are jumping on sort of on the bandwagon and creating this housing. Here in LA, I feel like we have a long way to go. And again, we have, as you know, and just sort of paired what Karen was saying in regards to like who qualifies as homeless, what, you know, who is a homeless individual, what does that mean? How do we measure that in the LGBT community? I think we still got quite a ways to go.
The other thing I feel like I should lift up a little bit is federal law, like legal, actual updates to the federal law on housing. And, you know, one important update is, you know, many of you heard of the Bostock decision, which is the decision saying that Title VII, which bars discrimination in employment nationally, that because Title VII bars discrimination on the basis of sex, the Supreme Court, or I should say, Title VII bars discrimination on the basis of sex, and the Supreme Court in the Bostock decision said that sex under Title VII is inclusive of sexual orientation and gender identity. And the Biden administration, one of the good things they've done that we alluded to earlier, is to say that in any federal law, if it's a federal law that bars discrimination on the basis of sex, that's also inclusive of sexual orientation and gender identity. So what's most relevant here is the Fair Housing Act also bars discrimination on the basis of sex, and the Biden administration has interpreted that to include a bar of discrimination on the basis of sexual orientation and gender identity. So that's also a huge step forward, which should impact the ability of LGBT older people to find housing that's at least a little bit more welcoming. It's not a panacea, just like race-based discrimination still takes place, even with the Fair Housing Act, but at least it puts us on a path in the right direction.
And I would just add one more thing, and then I'll stop. And if anybody here in the audience is, works in the housing sector, or works, sort of under a HUD contract or whatever, I would say also bring back the HUD 202 model, which was a great model for senior housing. And they sort of dismantled it back in 2010, 2011. It was a great model for senior housing. It provided affordable housing for seniors across the board. So it's just something else I was thinking of. But thank you for letting me get that last plug in.
Sure, I knew we'd have a lot to say about housing, so that's great. Well, and it's great. I mean, one thing I will say is when I was when I was a postdoctoral fellow at University of Michigan, I facilitated some support groups for older LGBT folks, and to a person, the biggest concern that they had was where were they going to live when they got older? People who were partnered, people who were not partnered. Like it was the main concern that they had. So I think that speaking to this is really important.
Yeah.
I'm sorry, go ahead.
And if I could just
of course,
throw in a comment right there, in this post, marriage equality age, especially in my observation here in California, is that a lot of our, and this is my personal opinion, LGBT community has become complacent. We have a lot of protections in place. And in my direct experience, LGBTQ adults, and I'm saying 30 and 40 and above, are not speaking up for themselves and for their rights. They don't know their rights. They don't know how to speak for their rights. And here in California, the second largest organization that advocates for older adults is called CARA, the California Alliance for Retired Americans. It's been around for a number of years. They have a membership around 1 million throughout the state. But yet at my nagging over about a year and a half, they had their first LGBTQ older adult forum to teach and to educate their non-LGBTQ membership about the struggles of their LGBTQ members. Myself and about a total of 12 of us presented on that day of LGBTQ education. And I had to gently bring them up and say, you need to speak. They need to know what your struggles are. They need to know where your struggles are. Do you live in Southern California? Do you live in Central Valley? Do you live in Northern California? Because the struggles are unique based on where you live. So that is one of my struggles, is that a lot of these adults and older adults, they don't speak up. And we need for them to speak up. We need them to be more like Larry Kramer and Ivy Bottini and ask for their rights and challenge those in authority to make sure that they get their rights put in place.
All right, well, thank you all. So the next question is, how does ageism, both societally and in LGBTQ plus communities, affect LGBTQ plus older adults?
Well, Aaron, you want to go? You can go.
Yeah, I'll be quick. I think it gets back to that invisibility issue I talked about at the start. And for the younger LGBT folks, I think people don't want to think about getting older. And there's so much emphasis in the LGBT community, you know, like every community, maybe a little bit more on youth and looking good and all that stuff. So people just don't want to, you know, think about getting older. And I think if you don't want to think about it, then you're not necessarily going to act to help people who are, you know, getting older. It's just, you know, it's easier to just put it out of your mind and pretend it's not going to happen. So I think that's, you know, probably like the biggest, you know, side effect of ageism in the LGBT community is that invisibility. And I also think, you know, kind of related to that is, you know, you think of like places where people gather and social outlets, that sort of thing. And so many of them are based on, you know, going out to the bars and kind of have a youth focus. And I think there are fewer outlets for, you know, LGBT older folks to find community. And I think that's certainly a challenge.
I agree with what Aaron said. You know, I mean, I think we could have a conference on ageism actually, or a panel. And just, I think it's a whole sort of unexplored area that we're not really talking about so much. And we're, you know, we bury it a little bit. And, you know, my experience has been that we were, as a community, very youth-centered, especially, you know, going back the next 20, 30 years, you know, especially when we go back to the HIV/AIDS epidemic, you know, but everything was very youth-focused. I can tell you at the LGBT Center, it was a very youth-oriented organization. And senior services were this nice little mom and pop, you know, department over in the corner, you know, and then all of a sudden our aging population just exploded, and you know, we're starting to be recognized. So I agree with everything that, you know, Aaron says about ageism. The one thing that sticks out for me, especially in my work with older adults, is that in the coming out process, we tend to put a lot of emphasis on the youth and the process that they, you know, what they need to come out. But we have older adults who are coming out all the time with a very different experience of coming out based on, you know, their generations, where they were born in the world, what world they were born into. So I think that's something that we do need to explore even more so. And I always think of this, I worked with years ago, a 95-year-old gentleman who came out at the age of 95. Excuse me, and he was a Holocaust survivor. And, you know, he had a whole historical, you know, context of coming out that was, you know, life or death. And luckily he had the supportive family and so forth. So I think it's just a big conversation about invisibility as well, and being invisible within our own community, you know, for both men, women, you know, gender non-conforming trans folks. It's like there's this invisibility within our own communities that, you know, we need to address.
Yeah, my favorite topic. I love being at the Gay Elder Circle because the name itself is visible. You know, I have a LinkedIn account that is for the setup of the Gay Elder Circle, and they know they're talking to or communicating with a gay elder. And one of the greatest things, you know, if there are great things that happened COVID, is that it broke down a lot of barriers that people wanted to like hang on to older adults. And if they could nail a gay older adult to have intergenerational conversations, they have them. I participated in about 4 of them during the COVID pandemic so far. And it's really nice to get that conversation going. And that is part of our mission statement, is to be visible elders in the community. And I have some LGBTQ older adults that they get angry with me because they say it's like, it's all about you. You know, they're saying it's me, me, me. And like, it can't be about you. And I'm like, yes, it can, because you're not speaking up. You're not visible in the community. You're out there doing what I do, which is crossing that LGBTQ line and doing workshops in the non-LGBTQ world and educating everybody. So it's not just educating our own community, it's educating the non-LGBT community. And that's a lot of where my work is in terms of the workshops that I've done. So I have been welcomed with open arms at every place I've gone because I'm out and open. And, I do tabling at parks when, pre-COVID and again, post-COVID, and have this banner that we hang on the end of the table that says, 3x5, gay elder circle. And I have people come up to our tables and like, thank you for being here. Thank you for being visible. And it also stimulates conversation about aging. And fortunately, I forget her name off the top of my head, but working on reframing aging, not only for our heterosexual counterparts, but for the LGBTQ counterparts. And how does that address things? A few weeks ago, SCORE, which is an older adult program, focused a day on intergenerational activities. And on Saturday at the LGBTQ Health Symposium hosted by Exeter, they were saying multi-generational. They were not saying intergenerational, because when you talk about intergenerational, you're talking about younger people and you're talking about older people. But when you're talking about multi-generational, you're talking about everybody in between, all the entire spectrum. So I actually had to think about that for a second. I said, yes, I need to reframe my own language and say multi-generational instead of intergenerational. And we have to include people of color and diverse backgrounds and in these conversations so that we can learn from them. One of the things that I do in my workshop is I compare cultural competency versus cultural humility. Cultural competency is like taking a course in college. You have a syllabus, you start with A, you end with C, and you learned it, and you took a test on it and you passed. That's not what cultural humility is about. Cultural humility is co-learning, and it's open-ended. You both learn from each other. So the student is going to learn more from the person that they're working with, but it's never ending. It's always changing, providing a unique relationship between the two that are involved in that, or even the group that are involved in that, which probably definitely elevates, the continuum of care for that person. We have to understand that our heteronormative counterparts have a pyramid-shaped support system. They're taking care of their parents, and then there's them, and then their children take care of them. But for many LGBTQ older adults who happen to be single, their support system is horizontal. And so their cohorts that are in the same relative age range as they are is going to be the ones that are going to be taking care of them. And knowing this and making our care providers, whether it's mental health or social and wraparound services, know and understand this horizontal care that is in place helps, educate and provide this program design and program development to focus on family of choice and who's able to do what. Because if I'm 78 years old and my cohorts are 75 years old and 82 years old, they're not going to be able to get in the car and drive me someplace. So understanding all these variables and educating it, but to truly implement multi-generational programming is really, what everybody is talking about, especially a lot more during the COVID crisis. And really, what does it look like? How do we reduce social isolation? And I say digital isolation, because we're right now, even on this Zoom call right now, we are missing people that do not have access to technology that may want to participate. So I always keep that in the back of my mind. These people are not only socially isolated and physically isolated, they're digitally isolated. And I work and I advocate for digital inclusion and, find if, CARES Act funding is dried up, but looking for other sources of funding to get, tablets, hotspots and stuff into the hands of older adults so that they can participate. And even when, COVID happened and everybody was talking about telehealth, I'm like, wait, you left out all the voice-assisted devices. Why are you not including Cortana and Siri and Echo Dots in this care? I can send a voice message through I have 2 Echo Dots in my house. So I can send, voice messages from my Echo Dot to my friend's Echo Dots, halfway across the city. So, and people are like, well, we did leave out voice-assisted devices. So I'm saying include the spectrum. We need to look at, when you do an intake, does this person have technology, yes or no? If the answer is yes, what technology do they have? Can we help them out with the technology that they have in place? So yes, to be visible in multiple ways, whether it's in person, at your city council meeting, at your county board of supervisors meeting, with your healthcare provider. And we're very fortunate that we have many LGBTQ friendly healthcare providers in our county. I'm very fortunate that I've been talking to many universities and bringing, my knowledge to the gerontology students that I've been talking to over the past academic year, and opening their eyes to all these barriers that they didn't have a foundation for. And, I expressed my gratitude for speaking, and I said, you are our future leaders, you are our future decision makers. And it's very important that you bring speakers like myself into your gerontology class so that you can understand firsthand what is going on and how to understand it. So I could go on this for a long time, like my favorite thing, but it's great, that I, have all my social media accounts right here, somewhere up there. And, it says Gay Elder Circle right up front. You know what the topic is, and you know what's going to be posted there on that social media platform.
So we're at, we have about a half an hour left. I want to make sure we have time for questions. I have, if folks have questions, please put them in the Q&A. What I'm going to do right now is just ask each of our panelists to briefly address an issue that we did not address here. Now, clearly there's lots and lots and lots of things. There was no possible way to address the various components that are affecting older LGBT folks. So is there anything, like one sort of thing that we didn't talk about here that you think is very important for people to think about, know about, etc.? And then we'll move on to Q&A.
There's two things go ahead, Tripp.
Well, no, I was just going to bring up diversity. Of course, is like one thing we should definitely touch on. And that was sort of my initial impulse. So go ahead, Aaron.
Yeah, I had two policy-related updates that are probably worthwhile talking about. So one is the Equality Act, which folks have probably heard about, but the legislation that includes comprehensive LGBT non-discrimination protections. And while you're all doing pretty well in California with respect to those protections, there are 28 or 29 states, depending on how you count them, that currently don't have those protections in place. And we need to get to 60 in the Senate to make it happen. And again, you might be thinking, oh, I'm in California, our senators are good, pro-equality, but we still need you, even if you're in California, to call your members of Congress, particularly your senators, and ask them to, take a lead on this and to stand strong and push for this. Because if no one calls and you take those folks and those votes for granted, then, if there's a lot of pushback in the Senate, they might not think it's worthwhile to move forward on it because they won't think anyone really cares about it. So it's equally important for people in California to call their senators and tell them this is something that they care about. The other thing I'll mention is that language I referenced last year that got into the Older Americans Act. Now your state unit on aging, your state Department of Aging, has to implement it. So it's important for you to reach out to the state unit on aging, to your AAAs, and to make sure that any plan that they put together, every state and every state unit on aging and the AAAs have to put together plans every few years that they submit to ACL, the Administration for Community Living. And in those plans, they spell out how they're going to implement the law. And we want to make sure they implement the new law as robustly as possible. And related to that, we worked with a whole bunch of folks in California, and the governor recently signed legislation designating older people living with HIV as a greatest social needs or target population. We worked with Equality California and some others to do the same just a few years ago with respect to LGBT older folks. So again, with respect to those laws, law is only as good as it's implemented. So if it's just going to sit in the books, it's not so worthwhile. And we need to really put pressure on the state to make sure they're implementing those laws really well. And I've heard various accounts of whether they're implementing the LGBT greatest social needs law or not, depending on who you speak to and on what day. It seems to kind of differ. So it's important that we keep the pressure on, even though we have some good laws in place, we want to make sure they're implemented well. So I will stop there.
I'm just going to say that we need to expand what we're doing here tonight. You know, at the university level, for sociology departments, for students who are majoring in gerontology, to up their programs to include LGBTQ older adults, because their programs barely touch on them. They don't really know anything. You know, I worked with some graduate students at the end of 2020 on LGBTQ literacy, older adult literacy. So again, as I just previously said, you know, having speakers like me, having diverse speakers come in and speak to the class, and having a well-rounded, you know, educational curriculum where we can educate our future leaders, our future decision makers, so that when they're actually, you know, graduating and going into practice, they have this knowledge, a bigger knowledge base to work from. That's been the biggest blessing that I've had, is to work with you know, the gerontology students the past academic year. In 2017, there was a poll, and I had mentioned this earlier, about Gallup poll, 110 million single Americans in the United States. If you're a gerontology student, it's quite possible that an older adult you're working with is going to die while you're caring for them. Part of what I did during the last academic year was to hold a death cafe. Part of that death cafe was I made an arrangement with the organizer, said, like, you must watch this particular documentary before I agree to do the death cafe, and I want your feedback on it before we do the death cafe. The documentary is called A Certain Type of Death. It's a documentary by the LA Coroner's Office on what happens when the coroner's office comes in and picks up the body. They had never realized that's what happens if you're old, or not even old. You die alone, and you have no family members to come and claim the body. And what is the role of the coroner's office with that body? They had said that they had never experienced that, and they had no knowledge of what the coroner's role was in this. So for me, not only to bring them education on LGBTQ older adults, but to say, you know, we are mortal, we will die. Do you understand what's going to happen when we die? It's not the end. You know, your body is going to go through something. Family claims it and you have a nice funeral, or your family doesn't claim it, you don't have anybody, and the coroner takes care of it. So by providing this type of education at multiple levels for sociology students or gerontology students or community health workers, you know, health science majors, we need these voices to be heard in the educational system. The students who will be leading us in the future need to know all of this.
Great, thank you all so much. So now I'm going to go to the questions that have been added to our Q&A. And I will start with this first question, and I'm really glad that whoever it was, it's an anonymous attendee, which is great. I'm glad they brought this up, because this is something that I wanted to ask about as well, which is, how does racism come into play as well for LGBTQ plus elders of color? So we talked a little bit about ageism, but how does sort of the intersectional piece work?
Well, I felt like it was important too to like bring up diversity, you know, and inclusion as part of the conversation, the broader conversation. You know, my experience, and I can just share from my experience working at the Los Angeles LGBT Center, that, you know, racism is still very much, you know, a part of the community. You know, I think we would be remiss not to acknowledge that, you know. And the lens which we look through is, how do we like break down, you know, how do we create diversity, inclusion into our programming and so forth. So at the center, we've really been concentrated on working towards this, because it exists. I think you just have to name it and say that it exists among our LGBTQ older adults. So, you know, I think we have also acknowledged that, you know, there's racism goes back decades, and it's something that a number of older adults, you know, have brought with them as well. So I'm saying the solutions are ongoing, you know, as we continue to sort of address these. I do know at the center at one point, this was a few years ago, where people of color coming to the center there felt excluded and didn't feel included in the program. They felt it was very much targeted towards the white community, specifically the gay white male community. And of course, there were women who are female participants also felt somewhat excluded. So in response to that, that includes hiring a staff that is racially diverse. And that includes people who are members of the older adult community as well. So from my perspective, and I know the other panelists will have things to say, I think it's an ongoing conversation. It's work that we need to continue moving forward with. I feel like we've made some inroads, especially in the last year and a half. And it's hard to say because we're a community-based organization and we've been working remotely now for like 18 months. So the goal is, of course, is when we open up our community center and, people are allowed to come back and participate. And, there's we're sort of missing that, interpersonal connection that we had before COVID, pre-COVID. That this work just continues, and we've had to create spaces for our for people of color at senior services that are specific to their needs. And we've also had to confront our own issues with bias and racism and how it's institutionalized. So I just think it's an ongoing dialogue that we need to continue to have. Excuse me.
Yeah, I just want to add kind of to what Tripp is saying there. I've attended many Zoom forums with older adults, who are seeking, to reduce their self-isolation, and just having all these social Zoom calls. And it's really interesting to note that, I make notes, I make lots of notes, but, pretty much throughout the pandemic, since everybody pivoted to online forums, 80% of the participants are white. We're lucky if 6% are Latino. And I haven't really even got like a 0.5% for African-American communities. So, there are some places, like Tripp had said, and Aaron has said, we look at institutions like the LA LGBTQ Center, the Long Beach Center, or other LGBTQ organizations. They have a white face to them. And the people of color population, community, do not feel represented by them. And even the Long Beach LGBTQ Center, they kicked out their executive director, who happened to be non-binary, but was very harmful to the African-American community and just got booted out. It was an ugly mess. And the executive director that's in there now is hopefully needs to heal that, is working to healing that. But still, I spoke to the new older adult manager. I'm like, we need to get these other populations in there. They need to feel comfortable. They need to be represented. I go look at the past programming, where these gaps are, where these deficiencies are. By doing this, this, and this, we can help chart the course to be more inclusive. That was an 1.5-hour conversation. But the other part of that is that the community has to let go of that past trauma and trust the new leadership. So we have to give them a chance to do their job. We need to let them get their footing. And so we're in a very pivotal role in our culture, here in LA County and in the United States, all this harm that, this racial harm that's been done, all these biases, we're looking at structural, biases, institutional biases, and working through all this, even in our own communities. So hopefully we can all work together to do that.
And the two things I'm thinking of are for folks who are not people of color, being more intentional about including people of color in our work. And one example of this is, in the wake of George Floyd, I reached out to someone who does a lot of work in the DC area, who's a Black, older lesbian. And one thing we talked about is the language that SAGE and other organizations use, when talking about LGBT folks. And she was telling me that, at least it's not 100% this case in the Black community, but it's certainly more common in the white community, is using same gender loving as opposed to gay. So that's the thing that we can think more about and don't act on as we talk about people, talk about issues, talk about policy proposals and whatnot, is being more inclusive in the language we use. And that's just a little thing, but it could make a big difference. And then I think the second thing I'm thinking about is listening to older LGBT people of color themselves, and about what issues they think should be at the forefront of our policy agenda or our other agendas, and listening to them about the types of work that we should be doing, as opposed to trying to guess or prescribe what we think is best.
Okay, great. And so the next question is, has harm reduction also come into play when caring for LGBTQ plus elders? And if so, how? And are we talking about harm reduction in terms of, I'm just guessing. So if there is a clarification, I'm assuming with respect to like drug usage, is that what we're talking about? That's the context in which I understand harm reduction the most. Does anybody have anything to say about harm reduction?
There's a comment that says harm reduction in terms of drug use.
That's the only context I know the term.
Right.
No, it's in the comment. Somebody put it in the comment
Yeah,
section.
Right. Yes.
So, speaking from my personal experience, people tell me I'm the odd duck out. I tell people I should be dead. And at my age, I should have HIV. I should have died. I should have died from cirrhosis of the liver if I didn't die from AIDS. I should have grew up drinking 40 ounces on the corner in downtown LA. But I'm still here. But many of my peers here in Long Beach who call me the odd duck is because they are, alcoholics. They are using meth, even in their older years. And I'm just like, not a part of that. And yet, the same people refuse to acknowledge that they are older adults. They cannot do meth forever, but unless they're William Burroughs. But, getting, proper meth education into our community, which I haven't seen our LGBTQ centers in the South Bay and in Long Beach do. Well, they do a pretty good job of it in Hollywood and West Hollywood, but not down here. And just drug use is pretty rampant, and it's really not addressed. Long Beach, a few years ago, formed the Long Beach Aging Services Collaborative, and they're not even discussing drug use among older adult population or diverse populations. They need to, because we live in a society where it's usually accessible. People who don't do drugs are not part of the norm, interestingly enough. But we need role models who have overcome any kind of drug addiction to step up, stand up, and speak up about the benefits of, weaning themselves off drugs and seeking help and assistance.
I just want to add, because when I think of this specifically in residential and sort of in the housing sector, because there's definitely substance abuse within the older adult LGBT community. I mean, it just exists, and it's even broader than just illicit drugs. I think one of the things that we've identified and struggle with is the overuse of prescription medications, or the misuse of prescription medications, and how that can sort of, and the use of illicit drugs with medications for older adults, and certainly how we provide sort of a harm reduction model in those settings, which is it's all done through our lease and how the lease is enforced. And, it really goes down to like non-payment of rent or a disturbance to the your neighbors or whatever. There's a lot of traffic coming in and out of your apartment. And then services, on the social services side, our supportive services team will come in and hopefully assess and offer assistance and referral. we've literally, like, and I just want to say, we've literally had residents, members who come to, you know, senior services where we've literally driven them to detoxes and, you know, residential care programs, drug programs, and so forth. I would say with a modicum of success, you know, and also where we've seen people literally coming into the center, you know, who are, you know, high or drunk and are asked to leave. But there's nothing, you know, outside of that, there's really no sort of punitive measures. So I think harm reduction, it's a good question. I think it's something in the older adult community that's greatly, as Bill said, it's sort of a hidden issue. It's one that I think we're afraid to address in many respects, and open to dialogue on that, definitely.
You know, if I can kind of add that just a little bit, you know, for the LGBTQ community, especially for gay and bi men, you know, going to circuit parties doesn't help when you're going to a circuit party at 50, 60, 70 years old, into these environments where drug is pretty common. Historically, you know, we couldn't get married, we didn't have children, so your adolescence could extend into your 50s and 60s. And so I can party. And we don't have, you know, adequate solutions or alternatives to things like circuit parties. And that's, I think, something that, you know, is a bigger issue. But given, you know, hats off to Tripp and the LA LGBTQ Center, you know, they're doing older adult dances and other activities, solutions. But again, if you live in San Pedro, if you live, you know, in Pico Rivera or in Whittier, it's really hard to get over there. But at least there are efforts, and efforts need to be replicated throughout the county.
Okay, so the last question that we have is one of our audience members was asking, could you go into more detail about SAGE? What is SAGE? What do they do?
Sure. So SAGE was founded in New York City in 1978, and we are the world's largest, oldest, and well, let's see, I'm like, my mind is going, so it's like almost 11 o'clock here. It's the nation's largest and oldest organization dedicated to improving the lives of LGBT older people. We currently run about a half dozen LGBT targeted senior centers in New York City. We also run a federally funded National Resource Center on LGBT aging, which provides information to LGBT older people themselves, to LGBT organizations about how to better serve LGBT older folks, and of course the aging organizations about how to better serve LGBT older folks. In addition to that, we have a whole training arm called Sage Care, where we've trained and credentialed tens of thousands of people across the country in LGBT cultural competency or humility, depending on the day. I run our advocacy program, where we advocate for LGBT inclusive federal aging policies and LGBT inclusive aging policies at the state level and local level as well. So that's kind of SAGE in a nutshell. We have a bunch of initiatives in addition to that. So both Tripp and Bill referenced the housing symposium we put together last week. So that's part of SAGE's LGBT Elder Housing Initiative. We have programs, you know, mostly through our senior centers in New York and through the case management we do, helping people in all sorts of, you know, situations and facing all sorts of challenges. So for example, we do a lot with older people living with HIV. We have a SAGE Positive program, which helps folks navigate growing older with HIV. We have the longest running HIV elder support group in the country. And we have a friendly visitor program we run in New York City, and also in Wilton Manors in Florida, where people can sign up to become, you know, regular visitors for someone who is homebound. And then during COVID, we launched a kind of like a virtual version of that called Sage Connect, where anyone in the country can volunteer to regularly connect with an LGBT older person. So yeah, it's a whole slew of programs, from our direct social services and case management in New York City and our senior centers in New York City, you know, to the work we're doing on a national level. And then I should also mention we, in the last year or two, opened up New York State and New York City's first LGBT elder-friendly housing buildings, one in Brooklyn and Fort Greene, and one in Crotona in the Bronx. And they both have LGBT senior centers on the ground floor. So that's kind of cool. It was an additional kind of manifestation of our LGBT elder housing initiative.
Great, thank you. So there's 3 minutes left. One of the things I just wanted to raise was in the question and answer, and I don't know that you have to necessarily answer this, but I thought I would at least share the information. One of the participants was asking, has the center and the Gay Elder Circle connected with AARP, and is there sort of any interaction between any of your groups and the AARP? If someone wants,
just really quickly, yes, we have worked in partnership with the AARP over the years, from sitting on panels like this, and, you know, talking about our LGBT older adults, to actually working with them directly and providing some very basic services that AARP offers to older adults.
Yeah, and I've worked with the LA LGBTQ Center. In fact, Tripp co-hosted a workshop with me for the Department of Mental Health for the second annual LGBTQ mental health conference. We co-hosted a workshop, but through CARA, again, we have a direct relationship to AARP through CARA, and they were part of that older adult programming earlier this calendar year.
Great, thank you very much. Okay.
Now, I don't want to. Sorry, I want to add real quick.
Sure.
Aaron had mentioned the National Resource Center on LGBTQ aging. They actually have an ambassadorship program. So you can become an education ambassador. Yes, I'm an education ambassador for the National Resource Center on Aging.
Thanks for the plug.
So yes, I do workshops like this. It's LGBTQ Older Adults 101. It's this very soft pedal introducing to LGBTQ issues. It's a well-diverse presentation, and I've been a part of it for, I think, 4 or 5 years now.
Great, thank you. And one last question that I think we can get in before we have 1 minute left, which is, what's the best way to keep updated with SAGE's work? Is there a website? Can you get on a mailing list?
There is, in fact, both of those opportunities. So go to SAGE. I'm going to type it in right now. sageusa.org, and there you'll find our website. And I should know this because I just haven't done it myself, but I'm going to look right now. I think you could probably just sign up for newsletters and whatnot there. We have our Get Involved tab. It's where you can donate money, of course, attend an event, and take action, and get on our mailing list. Why not? You'll hear about all of our advocacy opportunities and ways you can weigh in. I'll also point you to, I think it's still live, this website focused on the Equality Act and ways you can get involved there. So sageusa.org/equality time. I'll put that in the chat.
Fantastic. All right, well, we are straight up 8 o'clock. And for Aaron, it is 11 p.m. Thank you so much for sticking around with us. The time difference can really hurt at this time of day, so thank you. But yes, let's all thank our panelists for joining us and sharing all of this incredible information with us. We really appreciate your participation, your time. I learned a lot tonight, which is great because I'm writing a book. And I'll be sure to cite you if I, in fact, am using any of the material that you've provided. But yes, thank you very, very much for your participation. And thanks to the audience for being here as well.